The last time you were on, we talked. You shared about the Gates Foundation, the work you're doing in Africa. Can you give us an update on what's going on there?
Sure. So the challenge in South Africa: 65 million people, 16% of the population is HIV positive, and the challenge of coordinating care across what is a very heterogeneous country. Right? There's urban, there's rural. There are issues with infrastructure. Network bandwidth is expensive and slow. And identity management, who are you, is actually a challenging question because names are misspelled, workers move around. So with the Gates Foundation, we took the process of care delivery and broke it down into several what I'll call APIs or core functions. So core function one, who are you? So we'll do identity management and we'll do it based on biometrics. Because name, gender, date of birth match doesn't work so well. Issue somebody identity cards, hard to know. But biometrics, if I say I'm going to take fingerprints, eye scan, retinal or iris, palm vein geometry, or whatever is the biometric of the future, but build a system by which I can link your data by biometrics, that's an interesting infrastructure. So sort of API number one is a general biometric infrastructure. And we've deployed that in the right to care clinics and now can tag your HIV laboratory data to you. So you just walk into a right to care clinic and it says, here are the last 5 viral loads that you've had showing your medication is working very well or not. Those are problem one. Problem two is, how do I share the data with a patient? Right? As we'll talk about, I'm sure, there's this increasing trend in the US of patients getting access to their own data, their notes, etc. Well, hey, Bill, do you have an iPhone 10? Well, imagine that in South Africa, my lowest common denominator is the Nokia flip phone you had in 1997. Running on a GSM network, maybe. And so we've had to create a medical wallet for the patients that runs on a feature phone over very low bandwidth. And that's something we've deployed. We did a lot of usability testing, and keeping a good number of folks in South Africa on the team really helped us what the needs assessment was. And then the final question is, how do I deal with population health and data aggregation and look at variations in care quality and understand trends? So what we're working on currently is how do you expand what our early work on biometrics and this medical wallet to something that's going to help for countrywide population health analytics. And that, of course, could be machine learning, and it could start in South Africa and scale to other countries. So what's the platform? So we're starting to think through that.